Hi friends, in this video we will discuss the mediastinum, and under it first we will discuss the definition, the boundaries, and in the last we will discuss the contents of the mediastinum, and it is very important for your PG entrance exam. So friends, first let's talk about the definition of the mediastinum. As the name suggests, midi means middle or central space or central part. Central part of what? Central or middle part of what? Thoracic cavity. So this is our thoracic cavity, which is actually the continuation of our neck. So this is our neck, and this neck is continuing as a thoracic cavity, and this area of the neck which is continuing as a thoracic cavity is called as thoracic inlet. And this is the middle or central area that is present in the thoracic cavity, that is surrounded from the sides by the pleura of the lungs. So these green lines are the pleura of the lungs. One is of left side and one is of right side, and this is the middle space, middle area, and it is called mediastinum. And the area of the neck which is continuing as a thoracic cavity is called as thoracic inlet. Now what I am doing, I am taking sagittal section of the mediastinum. So this is sagittal section of the mediastinum, and with the help of this sagittal section we are now able to understand very well the boundaries of the mediastinum. So on the anterior side and on the posterior side, anteriorly this one is the sternum, and posteriorly these are the vertebrae from the T1 up to the T12. Now the sternum, this one is the sternum, and sternum has three parts: manubrium, body, and xiphoid process. And the point where the body and the manubrium joins, they make some angle, and that angle is called as sternal angle. So sternal angle is present at the junction of the manubrium and the body of the sternum. Now from the tip of the manubrium up to the upper border of the T1 thoracic vertebra, there is a circular area, and that circular area is called as thoracic inlet. So anteriorly sternum, posteriorly T1 to T12 thoracic vertebrae, and superiorly this one is the thoracic inlet, and inferiorly from the xiphoid process up to the T12 thoracic vertebra, this is what? This is our diaphragm. So area which is surrounded by all these parts is called as what? Is called as mediastinum. So this is our mediastinum. Now what I am doing, I am drawing an imaginary line from the sternal angle up to the lower border of the T4 thoracic vertebra, and this imaginary line is called as thoracic plane. And because of this thoracic plane, mediastinum is divided into two parts. The part of the mediastinum that is present above the thoracic plane is called as superior mediastinum, and the part that is present below the thoracic plane is called as inferior. This whole part is the inferior mediastinum. So because of thoracic plane, the mediastinum is divided into two parts, superior and inferior mediastinum. And now because of the heart with pericardium, the inferior mediastinum, remember, okay, inferior mediastinum is divided into three parts. The part of the inferior mediastinum that is anterior to the pericardium is called as anterior mediastinum, and the part of the mediastinum that is present posterior to the heart or pericardium is called as posterior mediastinum. And the area of the inferior mediastinum in which heart along with the pericardium is present is called as middle mediastinum. So if we talk about the boundaries of the superior mediastinum, so anteriorly this one is the manubrium of the sternum, posteriorly T1 to T4 thoracic vertebrae, superiorly thoracic inlet, inferiorly thoracic plane, and on the sides these are the pleura of the lungs. So this one is the superior mediastinum. Now coming to inferior mediastinum. So the boundaries of the anterior mediastinum, anteriorly the body and the xiphoid process of the sternum, posteriorly this one is the pericardium, inferiorly this one is the diaphragm, superiorly this one is the thoracic plane, and on the sides obviously what? These are the pleura of the lungs. Now coming to posterior mediastinum, so its anterior boundary by the pericardium, posterior boundary by the T5 to T12 thoracic vertebrae, superiorly by the thoracic plane, inferiorly by the diaphragm, and on the sides obviously by the pleurae of the lungs. Now coming to the boundaries of the middle mediastinum. Anteriorly this one is the posterior surface of the sternum. Posterior boundary are descending aorta, this one is the descending aorta. This is azygous vein, and this one is the esophagus. So posterior boundary of the middle mediastinum are esophagus, descending aorta, and the azygous vein. So the posterior boundary you can remember it by ADA. ADA means from the E it is esophagus, from D it is descending aorta, from A it is azygous vein. And superiorly this one is the thoracic plane, inferiorly diaphragm, and on the sides obviously what? Pleurae of the lungs. So friends, this is our heart, and from the left ventricle this is the ascending aorta, and this one is the arch of the aorta, and this is descending aorta. This is left brachiocephalic vein, this is right brachiocephalic vein, joins together to form superior vena cava. Now as you all know, from the arch of the aorta this is the left subclavian artery, this is left common carotid artery, this is what? This is brachiocephalic trunk. So from the arch of the aorta these three arteries arises. And now in the left brachiocephalic vein, the thoracic duct and the left superior intercostal vein drains. So the contents of the superior mediastinum are arch of the aorta, left subclavian artery, left common carotid artery, brachiocephalic trunk, and this is left brachiocephalic vein, this is right brachiocephalic vein, this is thoracic duct, and this is left superior intercostal vein, and this is upper half of the superior vena cava. So if upper half of the superior vena cava is present in the superior mediastinum, so obviously the lower half of the superior vena cava will be present in the middle mediastinum. And as you all know, from the right ventricle the pulmonary trunk arises, and the pulmonary trunk give rise to the right and the left pulmonary arteries. And from the left ventricle this is our aorta, and aorta is going as ascending aorta. So ascending aorta, pulmonary trunk, right and left pulmonary arteries, and also these pulmonary veins right and left which are draining blood into the left atrium are contents of the middle mediastinum. Now friends, let's talk about the contents of the superior and inferior mediastinum. And the contents of the superior mediastinum are very important for your PG as well as for your theory exam point of view.